Life is full of surprises. Sometimes those surprises include unintended pregnancies. It's important to remember that you have options. Emergency contraception can provide peace of mind and control over your reproductive health. Millions of women experience unplanned pregnancies. Many factors contribute to this, such as contraceptive failure or unprotected intercourse. Emergency contraception offers a safe and effective way to prevent pregnancy after unprotected sex. Remember, you are not alone. Emergency contraception is a responsible choice that allows you to plan your family on your own terms. It's about taking charge of your future and making informed decisions about your body. Let's be clear, emergency contraception is not the same as abortion. It's crucial to understand this distinction. Emergency contraception works by preventing pregnancy. It is established. Emergency contraception is used after unprotected sex or contraceptive failure. It acts as a backup plan to reduce the risk of pregnancy. It's important to note that emergency contraception is not intended as a regular form of birth control. Regular contraceptive methods like birth control pills or condoms are more effective for ongoing sexual activity. Emergency contraception is specifically designed for those just-in-case situations. You have choices when it comes to emergency contraception. The two main types are emergency contraceptive pills, ECPs, and the copper intrauterine device, IUD. Let's take a closer look at each option. First, we have emergency contraceptive pills, commonly known as the morning after pill. There are two main types, Plan B and Ella. Plan B is available over the counter, while Ella requires a prescription. The second type is the Copper IUD, a small T-shaped device inserted into the uterus by a healthcare provider. The Copper IUD can be left in place for long-term contraception. Both ECPs and the Copper IUD work by preventing pregnancy, but they do so in slightly different ways. Understanding how they work can help you make informed decisions about your body. ECPs contain hormones that primarily work by delaying ovulation, the release of an egg from the ovary. By delaying ovulation, ECPs reduce the chance of sperm fertilizing an egg. The Copper IUD releases copper into the uterus. Copper acts as a natural spermicide, preventing sperm from reaching and fertilizing an egg. Additionally, the Copper IUD may also prevent a fertilized egg from implanting in the uterus. It's important to know that the sooner you use emergency contraception after unprotected sex, the more effective it will be. Don't delay. Plan B is most effective within 72 hours or 3 days after unprotected sex. Ella can be effective for up to 5 days. However, both are more effective the sooner they are taken. The Copper IUD is the most effective form of emergency contraception. It can be inserted up to 5 days after unprotected sex or even up to 5 days after ovulation. Section 6. Safety first. Addressing side effects and long-term health concerns. It's natural to be curious about potential side effects. Rest assured, emergency contraception is generally safe for most women. Serious side effects are rare. Some common side effects of ECPs include nausea, vomiting, breast tenderness, and changes in your period. These side effects are usually mild and temporary. The Copper IUD may cause heavier or more painful periods. It's important to discuss your medical history with your healthcare provider to determine if the Copper IUD is right for you. Section 7. Access is key. Where to find emergency contraception and planning ahead. Knowing where to access emergency contraception is crucial. It empowers you to act quickly when needed. Plan B is available over the counter at most drugstores and pharmacies. You don't need a prescription or ID to purchase it. Ella requires a prescription from a healthcare provider. The Copper IUD also requires a visit to a healthcare provider for insertion. Consider having emergency contraception on hand just in case. Section 8. Separating fact from fiction. Debunking common myths about emergency contraception. Misinformation about emergency contraception is unfortunately common. Let's debunk some of the most prevalent myths surrounding this safe and effective method. One myth is that emergency contraception causes abortions. This is false. Emergency contraception prevents pregnancy before it is established, while abortion terminates an existing pregnancy. Another myth is that emergency contraception is harmful to your health. This is also false. Emergency contraception is safe for most women and does not impact your long-term fertility. Section 9. Taking charge of your future. Choosing the best contraceptive plan for you. Emergency contraception is a valuable tool for reproductive health. However, it's crucial to have a long-term plan for preventing unintended pregnancies. Talk to your healthcare provider about regular contraceptive methods that align with your lifestyle and needs. Options include birth control pills, condoms, IUDs, and more. Remember, knowledge is power. The more you know about your contraceptive options, the better equipped you'll be to make informed decisions about your sexual and reproductive health.